thanks to Komal and Evangelist for kind of setting the stage and the context for this problem. So my goal with discussing about Project 3.2 is to give us just an overview of what are some of the key accessibility barriers when it comes to like creating connection and in rural and disconnected communities. So of course, like there are posters in the back which talk about more details methodology, and we have our amazing research team from like University of Alabama, University of Georgia, Clemson, NCANT, and FAU working on this. So I think they are the kind of bricks and stones behind this. What my goal would be to kind of give a review of what we have, what our current understanding of the field is, and perhaps tying it to some of the open questions in this space so that we can have a more meaningful discussion around in the panel as well, and maybe draw some connections there. Okay, so let me start with the tale of two neighborhoods. So the idea here is let's envision two types of neighborhoods. Let's consider the first one, which we can call a 15-minute neighborhood or neighborhood number one, where the person who lives, let's say, very centrally is in 15-minute proximity to many of the opportunities around them. This includes their work, their healthcare, education opportunities, places to stock up, places to go to community building activities, and be engaged in communities. So this notion of 15-minute neighborhood kind of enables, it shows that you are very central and you're connected, and in 15 minutes you are able to do what human thriving is all about. And let's contrast that to a Google Map image of one of the rural neighborhoods in North Carolina. I mean, of course, this is not this could be not the best representative picture, but the idea here is like when we think about as our centers focus on rural and disconnected communities, the big thing that's different here is that there are opportunities and there are people who want to reach those opportunities. However, there might not be efficient routes that connect them. There might be poor infrastructure connecting your place to the opportunities. There might be limited travel modes. Even the opportunities themselves might be missing. So while you may have some good, like one grocery store, but the healthy food options might be missing. Perhaps you have one hospital, but it lacks some urgent care or special care facilities. Similarly, like while people live in specific areas, there may not be accommodations for people for unique travel preferences, like if you have low income, if you are disabled, if you are elderly, or have don't have the car. So when we're envisioning these two neighborhoods, the key thing that I'm trying to emphasize is the central feature that differs here is there is higher accessibility in the first and poorer accessibility in the second. And that is what is kind of starting to become the central theme of Project 3.2. So this kind of ties very well with the two broad trends that we are seeing in our planning literature, especially over the last few decades. So the first trend is we are shifting away from mobility-based outcomes, where just what is the travel time, what is the shortest time path, to a more accessibility outcome focus, where who is able to access what opportunity, because that's what the central purpose of transportation is. And kind of parallel to that is the shift away from efficiency and aggregate outcomes. So just getting one level of metric for VMT or total system travel time, to that of more disaggregate level impacts, like how are people in one group disadvantaged over the other. So I will make a note that accessibility is not fundamentally very different from mobility either, because mobility is part of that. So you want to be able to move people quickly because that's how things will become accessible. But by focusing on accessibility outcomes, we bring to center stage that the role of transportation is to connect people to where they are, to the opportunities. So it kind of just changes the context on how we are placing our discussions. And of course, we have had the guest speakers in our webinars and a lot of amazing research in this space that we are building off from in our Project 3.2. So just to, again, contextualize, and maybe I'll formally define it, but So let's assume that there are travelers with unmet needs in one location, and there are opportunities that they want to reach. Then one definition for accessibility is the ease with which they can access those opportunities to satisfy their needs. So it's just a general measure of the ease with which you could access things. So in some ways, there are two levers to this accessibility measures. Poor accessibility might happen if there are fewer opportunities. So let's say there is a rural town where there is just one hospital. So like if there is just fewer opportunities or no opportunities at all, as we will hear about the deserts, that's in itself is a fundamental thing that will contribute to low accessibility. The second lever here is that there might be opportunities around you, but you cannot reach them. So that's where the travel modes and the infrastructure connectivity plays a role. So of course, we as engineers will likely not take the business side where we'll create opportunities and start opening malls or restaurants, whatnot. So our goal is probably focus more on the second lever, but while keeping in mind that the landscape does involve how opportunities are laid out around us. So again, if kind of going back to the tale of two neighborhoods, if I have the first lever of number of opportunities and the ease of using travel by a mode, then my 15-minute neighborhood is probably on the top right, has more opportunities and more ease of travel, whereas a typical disconnected community is probably on the bottom left. And this is where we can now kind of contextualize the other definitions in the literature. We call them different types of deserts. And we can kind of disaggregate that, the chart I had across the types of mode. So again, like let's say in one column, I have the ease of access by transit, ease of access by driving, ease of access by walking, biking. And on one of the rows, we can think about the food opportunities that you can access, healthcare opportunities you can access, job, and etc. So if I aggregate all the sort of inaccessibilities across the y-axis here, we can kind of argue that a food desert is possibly a region where there are fewer food opportunities available to you. Similarly, medical deserts where there are fewer healthcare opportunities. In contrast, we also define terminologies like transit deserts where you cannot reach opportunities regardless of the type by transit mode. So you can kind of start defining these terminologies depending on like how you do the aggregation in this space. Of course, there are other terminologies used too, like participation deserts. People are not able to participate, or opportunity deserts where there are just generally low or sparse opportunities. And I will also mention a caveat here that there is a trend to shift away from the desert mindset, especially in social sciences. The idea that when we say that this area is a desert is a little bit misleading. It firstly kind of puts a label that, oh, it's inefficient, so it doesn't regard for what it currently exists. Maybe people have some sort of way of managing themselves. So we don't need to just categorize them, oh, you're a food desert, we need to fix it. But going from the mindset of how do we understand it. And secondly, there is this terminology called food apartheid, which relates to that. We want to tie it not just with, oh, this is a food desert, it's a medical desert, but that there is a systematic issue here that is leading to disparities here. So it's just the terminology in themselves can make an impact. So there is a push towards shifting away from the desert mindset. So one of the key takeaways that we are carrying forward in Project 3.2 and I want us to have is that like this is the central message in the literature, that higher the accessibility that we provide, the more the prosperity we can offer to communities. And I mean, this is evident from the fact that from an economical point of view, transportation is like the heart of the trade here, of the modern economies. Like people trade like products, people trade ideas when they go to job. Similarly, firms trade things like technologies, expertise with the governments, with the people around them. So because the trade and exchange of these things is heart of the economy, and when we make things accessible, we enable it, higher accessibility means more prosperity. Similarly, it's a very fundamental measure from a very broader context as well, from both individual and organizational levels. So it enables higher employment rates, governs real estate prices, boosts income and productivity, investment decisions, etc. So from that perspective, like the central feature that comes down to is creating more accessible communities. And here is an example that we have found from extensive reviews of transit deserts and other spaces in the last several years. The transit deserts, if you look at in particular, if the regions that are classified as transit desert, they have a cycle of socioeconomic challenges, environmental harm, reduced well-being. So, which is like a cyclic pattern of economic disadvantage resulting in social isolation, resulting in heavy reliance on car, and then it's kind of feeding back into like unhealthy way of living or building communities, I should say. So the first takeaway message that I want us to have, I know I'm looking at the time here, is that if we as a center are looking at trying to help rural and disconnected communities address their challenges, we want to name and address accessibility poverty. And the recent literature kind of defines it this way, that it's a state in which person's ability to access essential activities, including work, social, healthcare, or leisure, becomes so low that they're unable to satisfy basic needs. So, and this can happen due to if you're not owning an automobile, having poor public transit, unaffordable things, physically inaccessible spaces, or sociocultural environment that are hostile to specific groups. So I think that's like one of the things that we are focusing on as the center, as well as in Project 3.2, that's at the heart of our work. So now I'm going to talk more about what are we doing to address it. So, and this is where we'll bring our engineering science lens that, okay, what is our way of understanding the current transportation system? How do we model it? And then how do we go about addressing it? So I'll present like a high-level framework for how things are done in modeling framework. So again, this may be one way of presenting it, but like I think perhaps it can seed some discussions afterwards. So I'll borrow this Manheim, Florian, Gaudry framework, which is commonly used for modeling transportation systems. So it's a little too many boxes here, but let me emphasize that if I fundamentally trying to understand a transport in an area, we first need a model for how activities happen. So that's the activity system there. So accounting for users' preferences, their beliefs, constraints, and how they make their decisions and policies. That kind of feeds into the demand that uses the system. Then on the other side, we have what our agency is providing. So that is the transport system or the supply side, and that governs the performance procedure here. And then in a traditional economic setting, we do want to study the equilibrium of them. Because if there is too much demand and very limited supply, people will realize that it's not beneficial to make that choice. They might switch away from that mode or take a different route or start teleworking, etc. So market equilibration helps us kind of study the steady states of these systems. And then comes the part where we can use that steady states to argue about what is the system level performance, and then how that system level performance feeds back into the way people choose locations. And then kind of, it's like a framework that's kind of is a cyclic loop in a way. And then, of course, it connects with the other infrastructures as well, because this is the way we are looking at transportation, but transportation is one civil infrastructure. We are also talking about the other infrastructure that exists in the environment. And like changes in one infrastructure feeds back into this. Similarly, the secondary infrastructure, which build off the primary ones, are also kind of part of this framework because they influence how we understand people making choices and their day-to-day, go about their day-to-day. So the key question for us then is, how can, going back to the accessibility part, how can accessibility be studied and improved using this modeling framework? And I'm going to argue about 3 levers. And the first one is we want models, or we want to address the gap of quantifying accessibility outcomes in a more meaningful way. So that's the first key sub-question. The second is we want to be able to explain why access is the way it is and how it might change with interventions. So a good modeling framework that can explain that. And third, we want to kind of design systems that can systematically improve the access for us. So in the remaining 5 to 7 minutes, I will give highlights of what our Project 3.2 is doing for each of the three. And again, as I said, there are posters in the back talking more in the methodology side, but I'll give a high-level review again, with the hope that it will spark some discussion. So when we look at how do we measure accessibility, again, the idea is you are at a location, opportunities. So it's a weighted function of how many opportunities you have as an inverse function of the impedance that you have to reach those opportunities. You can further disaggregate this measure by asking, where are we measuring the access? At what spatial extent? For whom are we measuring it? Is it low-income group, socioeconomic, disabled group, etc.? Which mode are we using for what activity, what time of day, and how are we defining the cost elements? And this is where the formulas can get crazy big, but the idea is we are still measuring the fundamental accessibility, just disaggregated by different groups. So then the cost element here or the impedance function here might need some clarification too, that you can kind of think of like typical impedance from going from one location to the opportunity where the need is unmet is the time, like the amount of time it takes for you to reach there. So that time can be perceived that I feel like it takes me longer, but it doesn't. Or there can be a quality of time as well, like people might want to bike a longer route, even if it takes them longer, versus the other sitting in the car in congestion. And similarly, whether we take shortest path equilibrium time is another factor to this. Similarly, we also can think of costs, the costs related to toll, parking, fuel, tax, fare, and even the externality costs. And so this was a little interesting for me, that externality costs typically don't show up in the way we measure accessibility, but it's still important because it impacts the communities. So I'll take the example of India, where the traffic is quite chaotic and people honk a lot. So there's a lot of traffic noise. So you might think that, okay, we are creating more accessible environment where at an individual level, if you're honking, it's fine. But there are studies that show that the periodic level of sound stress around you keeps your kind of nervous system at such strong alert that it creates like health issues, et cetera, et cetera. So those things feed back into how we live as communities. So I'm kind of connecting that externality cost as well. And then comes the part that, okay, we want to combine different costs using weights, like value of time, which can vary. So again, that's a distribution. And similarly, the choice of function we use to measure things is also can vary. For example, isochrones are more step-like function, where we say that anything inside the boundary is accessible, outside is not accessible. In contrast, we can have exponential functions, which are more general in nature. So once we have measured accessibility, then we can argue whether it's equitable or not. And this is where we can look at the distribution of that accessibility across the population group. And the key finding in the literature here argues that we need to start thinking about sufficiency in accessibility. It's like there is a threshold that we want to provide for everyone in terms of their accessibility. And then we will ask the question, how far is the population group below that sufficiency threshold? And how prevalent is that deficiency of accessibility? So which is kind of like the area behind that curve. So three arguments stand out here. That first, you cannot make equal accessibility because it's just a fundamental factor that people are at geographic different location. You cannot make things equal for everyone. So we have to bring this sufficiency standards can help to kind of mitigate some of the existing disadvantages. Second, the argument that a fair system should provide sufficient accessibility to all. And the third, that the way we set those standards should be a function of how communities drive it. So it should be a function of how the low accessibility impacts a person's life. So I guess in the interest of time, I'm going to skip this slide. So I'll talk about the research gaps that exist in the first lever, which is quantifying accessibility. And this one, so we want to first, especially for rural communities, we want to address data scarcity. That is the big issue that we are facing. So how do we use proxy measures? How do we kind of scrape data sets from various sources available to us to help quantify accessibility in the first place? Similarly, how to work with biased and error-prone data sets. Because if data is biased, your models will be biased, so will your predictions. So how to kind of mitigate that? Then addressing temporal dynamics to this, because people are moving with time, congestion varies with time. Similarly, tastes are heterogeneous across population. How do we incorporate that in quantifying accessibility? And then finally, also, how do we make recommendations on improving that accessibility measure? So what underlying story are we going to tell? Like, let's say we come up with a measure, it's like 5.2. What are we communicating from that measure? That's also a big part of research, because most of the time numbers don't convey things what we want to do. So in our project, what we're doing is the UGA team, I can speak more to this, but we are bringing some multi-resolution data analysis synthesis, as well as spatiotemporal data mining to kind of innovate the space of how do we quantify accessibility. And the other two levers, we're going to be very brief because this is a just general transportation modeling space. So I'm not going to go into deeper depth here. So traditional way it's done is we have behavioral models in one space, like how people make choices. Or we can do more data-driven models, again, which relates to behavioral models. So that can help us explain why access is the way it is or how we should change it. And in that space, there are also some research gaps that we have found. So first is the computational tractability of when we start talking about accessibility measures. So like we talked about market equilibrium, how justified it is. And do we really need to go for the space of agent-based models, because they can blow up exponentially depending on the size of the network that we are analyzing. So creating more tractable models, capturing unique perspectives of individuals in this space. And finally, how do we do a more system of system analysis instead of siloing a particular example that we have? And in Project 3.2, we are doing this, University of Alabama team is leading this part, where we are modeling latent demand and unique trip chain behaviors to understand the modeling gaps to explain access. And finally, improving access. We all have been hearing throughout the conference ways to do that. We either want to provide alternatives with like shared autonomous shuttles, microtransit, micromobility, or we want to bring opportunities closer through teleworking, telemedicine, mobile clinics, or we want to reduce the impedance, maybe have express lanes that is reliable travel time. Or we provide information. I think, as Komal pointed out, that most of the time we don't know the information about the thing existing, but so can we have trip planners or apps that can enable us to work better? How can we bring discounts and tradable credits to lower the burden of costs on certain groups? So those are all research questions in that space. And again, the gaps there is doing things in a more tractable manner, designing those technology, how to do incentive design, how to do control testing and deployment, because without knowing whether this intervention is helping, we cannot know, we cannot make a good recommendation or decision, and how to create interoperability in that space. And for that, our Project 3.2 is, again, trying to come up with using those modeling frameworks, creating solutions that can address that, while integrating stakeholder perspective. So I'll leave us with this question, the tale of two neighborhoods. The question that I'm asking and posing for the panel, the discussion we'll have is, how can we, including community members, not just we as researchers, can collectively envision the future for rural and disconnected communities in Southeastern US? And I will want us to remember the takeaway that fundamentally, and this has been helpful for my understanding at the very least, that fundamentally, if you want to help rural and distant communities, it's about addressing the accessibility poverty that can exist.